welcome to our channel again. And in this video today we're going to learn about the definition of addiction and the symptom according to the DSM-IV that any addicted individual may demonstrate during his addiction. Now let's move on to the typical definition of addiction. There's so many types of addiction that we individual may have within us during our lifetime. It might be related to food, it might be related to addiction, alcohol, it might be related to some other drugs, or so many types of addictions are there that we generally have during our lifespan. So, while talking about the definition of addiction, there are three major stages: attachment, withdrawal, and relapse. So, now let me tell you straight what kind of situation is termed as addiction. For example, there's a person Y. Let's take an example, and that Y is attached to smoke. He has to smoke certain amount of cigarettes in a day. Actually, he had started in a party with his friend and he continued it with the amount of cigarettes he used to consume during his daily life. After attachment, then there comes withdrawal. And after that person Y took so many cigarettes in his lifetime, and now he suddenly came to the fact that he has to withdraw from this addiction, then he tries to get out of this addiction. He tries to get out of this attachment of cigarettes. And it's like 1 or 2 days that he stops smoking, but then relapse comes. Relapse is the stage when the addicted individual again starts smoking with the fact that he had tried to withdraw it, but he got attached again. So let's talk about three process that occurs when an individual is addicted towards something. That's attachment, withdrawal, and relapse. Almost all addicted individuals, they return back to the phase they were addicted. It's because of the relapse stage. Relapse is the stage when almost all individuals who are addicted to something else, they return back and they get addicted towards it again and they start abusing substances again. Now let's talk about common symptoms that DSM-IV has categorized and psychiatrists or psychologists generally look onto while confirming that a person is addicted to anything. One is any person who is addicted to tobacco would be very irritated the day he would not get to have it. So this is very simple. If a person is addicted to drugs in injections, and if it has been 2 or 3 days that he is unable to inject it because of the circumstances, then he feels irritated. It's like he cannot he lacks concentration. Second one is lacking in concentration in the daily activities. The third one is unnatural cravings. Unnatural cravings, it's like it's the time you go to the bed, but the addicted person is having an insomniac feeling. He is unable to sleep, he is unable to rest, but there's restlessness within him. He's craving for the substance that he's not able to have. Any person who is addicted to drinking, addicted to drinks, he would have unusual cravings either in daytime or nighttime in order to have that bottle of beer or the bottle of liquor. So generally, addicted individual, what they do is, any individual who are addicted to something else, if they are forbidden to have that, they become violent. So that is the case when they are taken to the rehabilitation center, when they start kicking and hitting their loved ones. The fifth one is difficulty in behaving in social life. Any addicted individual, it's very difficult for them to act normally in their daily life. For example, in parties, it's like they do not have good interpersonal relationship because everybody have a stigma towards them that they are addicted individual. And if there is a person who keeps on drinking and drinking and is addicted towards it, there's high chance that he will not have any friends or relatives around him during social parties, because he tends to be very violent when he drinks, and it's like he shouts or screams or he gossips, and nobody around him likes that. Sixth one is increasing amount of intake. Okay, let me tell you one very interesting fact. Women, if they have the habit of drinking 12 glasses of alcohol a week, then it's termed as addiction. And if male, they have 15 glasses per week, it's termed as addiction to females. So there's, sorry, males. So there's difference in terms of gender in addiction. Females, if they have 12 glasses per week, they are termed as addicted to alcohol. Whereas males, if they have 15 glasses per week, they are termed as addicted. So this is the difference in uh, gender in addiction. So what happens is, generally people, they start with little intake. For example, any smoker, if we ask him when was the first time he smoked, then it's high probability to listen the answer that he had spoken in some circumstance, like with his friends. Or any other woman, if we ask him, sorry, if we ask her when was the first time you drank alcohol, and it's like she will say some earlier age, some younger age, during parties, or it might be genetically or hereditary. So this is the case. So I have termed 6 different symptoms here that any addicted individual demonstrate during the addiction. Now let's move on to different types of addiction.